If you're over 50, please listen carefully. Bowel cancer does not always begin with obvious bowel symptoms. In fact, rates are rising in the United States, with tens of thousands of new cases diagnosed every year. Many in people who thought they were completely fine. In many people, the earliest warning signs don't feel like a gut problem at all. They feel ordinary, easy to explain away. A bit of bloating, something you ate, feeling more tired than usual. That's why bowel cancer gets missed for years. Not because the signs aren't there, but because they don't look dangerous at first. In this video, I'll walk you through the early warning signs people over 50 dismiss every day, and the patterns that make clinicians like me take them seriously. I'm Nurse Ray, an active clinician with years of experience in geriatric oncology, and these are the exact signs I hear over and over again from patients who only recognize them in hindsight. Some of them are so common, so woven into your daily routine, that you probably never even thought of them as symptoms. Because when these signs start showing up together, they are not random. And I need you to pay close attention to sign 4, because when bowel cancer is caught early, survival rates are close to 90%. But this one everyday habit can quietly hide the disease for years from you and even your doctor. Let's go. Sign 1. The false alarm, or tenesmus. Picture this. You go to the bathroom. You feel like you've done what you needed to do. You get up, wash your hands, go back to whatever you were doing. 10 minutes later, you're back. That nagging feeling, like the job isn't finished, like there's something left that just won't move, it pulls you right back in. Most people over 50 put this down to needing more fiber or a sluggish gut, or just how things are now. And here's the problem with that. It sounds completely reasonable. So they buy a different cereal and move on. What I need you to understand is this. Your brain doesn't send that signal for no reason. That feeling of incompleteness, clinically we call it tenesmus. And one of the most common causes is a tumor sitting in the lower bowel, physically mimicking the sensation of stool that isn't there. Your gut is trying to pass something it can't pass. Think about that. If you've been living with this feeling on and off for months, and you've been blaming it on the wrong things, write it down. That pattern matters more than you know. Before I get to sign 2, I want you to think about the last time you looked at your stool before you flushed. Most people over 50 don't. And that habit alone is causing people to miss a sign so visible, so clear, that doctors consider a textbook warning. That's sign 2, coming right up. Sign 2, the pencil shift. This one requires a moment of honesty with yourself, because it involves paying attention to something most of us were raised not to look at twice. If your stool has gradually become narrower, thinner, more ribbon-like, almost like a pencil rather than the shape it used to be, that is not your diet. That is not because you had a light lunch. Think of a garden hose with something pressing against it from the outside. The water still gets through, but it comes out thinner, weaker, wrong. That's what happens when a tumor starts to take up space inside your colon. The passage narrows. The shape changes. Here's why people miss this. It doesn't happen overnight. It's gradual, over weeks and months. So there's no single day where you think something has changed. You just slowly adapt to a new normal that isn't normal at all. If this sounds familiar, don't Google it at midnight and talk yourself into anxiety. Just mention it to your GP. One sentence. I've noticed a change in the shape of my stool. That's all it takes to start the right conversation. Sign 3, the iron mystery. Are you tired? Not long day tired. Not bad sleep tired. I mean the kind of tired where you need to sit down after walking to the letterbox. Where you've started canceling plans not because you don't want to go, but because you simply don't have the energy. If your blood work has come back showing low iron, anemia, and your doctor said it's quite common at your age, we'll keep an eye on it. I need you to push back. Here's the medical reality that doesn't always make it into a 10-minute GP visit. Anemia in a person over 50 with no other obvious cause is bowel cancer until proven otherwise. That's not alarmist. That's the clinical guideline. Tumors bleed, not dramatically, not in a way you'd ever notice. Microscopic amounts, day after day, slowly draining your iron stores over months. By the time your blood test picks it up, it's been happening for a long time. If you've been told your iron is low and you've just been taking supplements, ask your doctor specifically whether a colonoscopy has been considered. Write that question down before your next appointment. Here's what I haven't told you yet. The next sign 4, isn't something your body does. It's something you do every morning, thinking you're being healthy. It's sitting in your bathroom cabinet right now, and it may be the most dangerous habit on this entire list. Stay with me. Sign 4, the laxative loop. You started feeling a bit backed up, maybe 6 months ago, maybe longer. So you did what any sensible person does. You went to the chemist, grabbed a gentle stool softener, maybe one of those smooth move herbal teas that everyone swears by, and you sorted it out yourself. Good on you for being proactive. Here's the problem. If you are now relying on that laxative or that tea to have a normal bowel movement, if skipping it for a day or 2 means things stop working, you are no longer treating occasional constipation. You are chemically compensating for a change in bowel function. And that change, the real underlying change that started 6 months ago, is still there, unexamined, untreated, potentially growing. This is the one that keeps me up at night as a nurse. Because the people who fall into this pattern are not being neglectful. They're being responsible by their own understanding of it. They're managing their health. They're not bothering the doctor over something embarrassing. They're handling it. But what they're actually doing is muting the alarm while the fire keeps burning. If you've been taking anything daily, softeners, fiber supplements, herbal laxatives, to maintain what you consider a normal bathroom routine, and this has been going on for more than 4 to 6 weeks, that is the symptom. The laxative isn't the solution. It's the cover-up. Sign 5, the gas ghost. Everyone gets bloated. That's not the sign. The sign is when it happens and whether it goes away. If your bloating is worse when you lie down at night. If you're waking up at 2 a.m. with cramping, uncomfortable pressure that takes a long time to pass, that pattern is specific. Persistent bloating that doesn't respond to dietary changes, that comes back in the same way at the same time, is a sign of pressure in the bowel, not indigestion. Pressure, a lot of women over 50 are told it's hormonal. A lot of men are told it's stress. Both of those answers shut down a conversation that should stay open. Sign 6, the red misconception. Everyone knows to look for blood in the stool. Bright red, obvious, alarming. But the cancers that are hardest to catch don't bleed that way. Higher up in the bowel, blood has time to oxidize before it exits. It turns the stool dark, almost black, tarry, or a deep maroon color. And here's the habit that buries the sign completely. Most people over 50 who notice dark stool immediately think, it's my iron tablets. Or, I had a lot of beetroot this week. Red wine, blueberries. And sometimes they're right. But if you're seeing dark stool consistently and you cycle through all your dietary explanations and it keeps coming back, stop explaining it away and start recording it. Date, frequency, color. Take that record to your doctor. Sign 7, the quiet vanishing. I've had patients come in and tell me, almost proudly, that they've dropped a few kilos without really trying. Finally, the weight is shifting. After years of fighting it, I have to be careful how I say this, but I'll say it plainly because you deserve that. Unintentional weight loss, 5 kilos, 10 kilos without dieting, without a change in activity, is one of the most serious flags we watch for. The body doesn't burn its own reserves without reason. If something is consuming energy that you're not consciously expending, something is consuming it for you. Don't celebrate unexplained weight loss. Investigate it. In 20 years of nursing, I've never once had a patient look at me after a good result and say, I wish I'd waited longer before coming in. Not once. If you recognize yourself in 2 or more of these signs, you need a colonoscopy. And you need to walk into your next GP appointment and say clearly, I want bowel cancer ruled out. Don't let "you're probably just getting older" be the last word. If this video gave you something to think about or something to act on, subscribe. Every week, I'm here to give you the honest medical conversation that tends to get skipped in a 10-minute appointment. Your gut has been talking. It's time to start listening.